Hello, I'm Dr. Anu. We are at HIMS Hospital, Dialysis, Chandigarh right now. We have a patient with us, Mr. Bharat Jain. Mr. Bharat Jain is with us since last 7 days. He's a CKD patient and he's on dialysis. I think it would be better that if we ask Mr. Bharat only what was his problems before coming to this hospital and how many times he was getting dialysis done and now how is his experience at this hospital. Yes, Bharatji.
Before coming to Dialysis, I had a dialysis thrice a week. Thrice a week was primarily because of water retention. About 4.5 liters per dialysis was my water retention. After coming here, they have had two wonderful therapies. One is a bathtub therapy, which has a capacity to remove your water from the body through sweat. Generally, my water coming out of the sweat therapy was about 700 ml to 1 liter. Then the what they call head down tilt theory, that also surprisingly has a capacity to reduce weight. Where the water is going, where the weight is going, I am not able to understand, but it is reducing.
So how many dialysis were you getting done before coming to this hospital?
Thrice a week.
Thrice a week.
Thrice a week, about
3 dialysis per week you were.
About 4 liters per dialysis was my water output.
Okay. And now, when was your last dialysis done?
It was done on the 15th of March.
15th of March. That means you have missed how many dialysis?
3 dialysis.
3 dialysis.
Yeah.
3 consecutive dialysis.
1 week. Yeah.
You have missed, and you are still having no symptoms of any dialysis.
Yes.
Do you have any problem in your body? Any swelling?
No.
Any other symptom you're getting?
No. But there's one interesting change. Earlier during dialysis, since the water used to be sucked out of the system, I used to have a dry skin, and that led to a lot of problems. Surprisingly now, because it is a hot water therapy, there is no dry skin system. So to that, my legs are better off right now.
That's very nice, Mr. Bharat. And since you are going home tomorrow, so do you want to convey any message to the public, to other people like you who are undergoing this kind of condition and who are having kidney problem? What is your message for them? What would you like to advise those people who are getting dialysis done?
I don't know what the system will work for without dialysis patients, but for dialysis patients, this is a very effective way of removing water.
Alright, Mr. Bharat, it was really pleasant speaking to you, and we feel very happy when patients like you, they come and they go home with happy faces. All the best, stay blessed, stay happy. Thank you so much.